All right, well, let's get the very latest news on the COVID infections. The stats have just come in. 19,506 people have tested positive for COVID-19 across South Africa in the past 24 hours. The bulk of them still in Gauteng, just over 11,000 of them are from Gauteng today. Alarmingly, 383 more people have died from coronavirus. And I'm joined now by vaccinologist Professor Shabir Madhi, Director of the Vaccines and Infectious Diseases Analytical Research Unit of its university. Prof, thank you so much for joining us. So these stats are not good. We're almost at 20,000 nationally, those infections, and we're seeing other provinces ticking up. Western Cape, over 2,000 infections. The Northwest, 1,428. I was going to ask you if we're perhaps reaching a plateau or a peak. Do you think we are?
I think for this week it's not surprising that those numbers would continue increasing, because many of the individuals that are presenting this week are individuals that probably have already been infected a few days ago. And the same thing would come to people that are being hospitalized. We can expect those numbers to continue increasing in most of the provinces for next week and probably the week thereafter, before we see any sort of material effect of the higher levels of restrictions that have currently been imposed. Whether we're peaking or not, difficult to say. I think Gauteng is probably due to peak, but for the other provinces, probably much less so, and especially the Eastern Cape, Western Cape, and KwaZulu-Natal. They're still at a relatively early stage of this particular resurgence. It is possible that the higher levels of restriction will flatten it out, but the problem is as soon as we go to lower levels of restriction and allow greater engagement at a public level, then we would expect a rebound in those provinces.
It was very interesting. A little earlier I spoke to our correspondent in India, and while infections are still very high, it's nowhere near what they had in May, where they had so many deaths every day, up to 4,000 deaths in one day, I think it was. And I asked her what has made the difference, and I'd love you to weigh in, because it wasn't vaccines and it wasn't special drug treatments. She said it was eventually the hospitals opening up, more field hospitals opening up, more people getting oxygen, and tighter lockdowns. Do you think that's the only thing left for us here in South Africa now as well?
Yeah, so I think the other component to what happened in India is that such a high percentage of the population eventually became infected that you would get a natural turning down of the wave. So I think it's a combination of factors. But to explain what happened previously in South Africa, both during the course of the first as well as the second wave, it's really about what percentage of the population become infected, where you get adequate amount of immunity at a level of the community, which together with interventions such as higher levels of restriction would cause the wave to start subsiding. So there are multiple factors, but certainly having more beds available would reduce the number of deaths that occur, because you're providing people a fighting opportunity of overcome the illness.
What are you hearing about bed supply in Gauteng? I spoke to Imtiaz Suleiman earlier, and he said we actually don't have an oxygen shortage. We have a bed and manpower shortage. Are you hearing anything positive about us perhaps getting a better handle on that, or is it still hellish in our hospitals?
Yeah, so unfortunately we don't even have a bed shortage. We've got enough beds. There's about 800 vacant beds in the COVID treatment facilities that are not being used, because we don't have healthcare personnel to actually manage those beds and manage the patients that are admitted. So unfortunately it's still extremely dire, both in the public as well as the private sector, so much so that people are literally sending WhatsApps to find out which facility has got an ICU bed available. And people are still waiting in emergency departments on a chair on oxygen for 2 to 3 days before they're admitted to the general ward to be managed. So the situation in Gauteng is certainly dire. I think when we say that there isn't a bed shortage, that might be true when you look at South Africa as a whole, but certainly not correct in the context of what we're experiencing in Gauteng.
It seems almost inexplicable. I spoke to the Junior Doctors Association earlier. 280 of them are still waiting for a placement, and this happens every single year. Surely we should be deploying them to help look after patients in those extra beds here in Gauteng.
Absolutely. I just can't understand why it didn't happen yesterday, let alone in the next few weeks. It probably will only get the act together in a month from now when this wave has subsided, which is not going to be too helpful. So absolutely, it's not just doctors, it's also nurses. And I think we need to understand that people are basically high in demand, and if we need to pay the premium, a premium in terms of ensuring that we can engage the services, right now that's what we need to do.
Professor, I want to ask you which vaccines are looking promising in dealing with the Delta variant. And I'm asking this because there's been some good research around Pfizer, I think Moderna as well, Johnson & Johnson possibly too. But I also want to ask you about Sputnik and Sinovac, because that issue is getting politicized. And I want to understand the science about why we haven't said yes to Sputnik and Sinovac, for example. But talk us through the vaccines that you think should be in this country right now.
Right now, the two vaccines that have got the most compelling evidence as to how well they work against the Delta variant is, in fact, the Pfizer vaccine and the AstraZeneca vaccine. For the Pfizer vaccine, after the first dose, you get over 90% protection, about 92% protection against hospitalization. And after the second dose, as high as 96% effectiveness against hospitalization. For the AstraZeneca vaccine, after a single dose, you get 75% protection. And after the second dose, 92% protection against hospitalization due to the Delta variant. For the Moderna vaccine, we expect it to work very similarly to the Pfizer vaccine. There's some experiments that have been done in the lab that corroborate that it probably would work as well as the Pfizer vaccine against the Delta variant. The problem with Sputnik 5 and a Sinovac vaccine, unfortunately, is that, yes, the vaccines very likely would protect against severe disease. But the companies, for some reason, haven't been aggressive in terms of ensuring that they do the necessary experiments, even in the laboratory, let alone in the field, to determine just how well those vaccines would work against its variants. And those experiments are not too difficult. So it's difficult to understand why there's so few experiments that are being done in the laboratories to be able to predict what you can expect of both the Sputnik 5, the Sinopharm, as well as the Sinovac vaccine against the Delta variant, as well as the Beta variant for that matter.
All right. Well, thank you so much for your time this evening. Much appreciated. You heard there from vaccinologist Professor Shabir Madhi, Director of the Vaccines and Infectious Diseases Analytical Research Unit at Wits University.